And joining me now is the Secretary for Health and Human Services, Dr. Tom Price, a former congressman from the state of Georgia. Secretary Price, welcome to Meet the Press, sir.
Thanks, Chuck. Wonderful to be with you. Appreciate it.
Let me start with a big ideological question in this way. The fact that it is not just a repeal of Obamacare, but you're trying to pursue a repeal and replace, isn't that an acknowledgement that the free market that you cannot have the free market run the healthcare system? Because if you wanted just a free market, wouldn't you just repeal Obamacare and start from there?
No, not at all. And obviously this is a transition that we're going through. But the important thing is to appreciate that the market as it is right now is failing. Obamacare, the ACA, has failed. You've got premiums going up. You've got deductibles where people have an insurance card, but they don't have any coverage. Got a third of the counties in this nation that only have one insurer offering coverage. 5 states with only one insurer offering coverage. That's not a choice, nor is it responsible to the individuals who are going to be selecting the coverage. So what we need to do is to fix this, to move in a direction that puts patients and families and doctors in charge of their health care and not Washington, D.C.
I know there's a lot of talking points that are being used that Obamacare is failing, but if you have a system where, yes, premiums went up, but also enrollees, the enrollment went up too, that's not the definition of a failing system.
Well, and in fact, the number of individuals who actually got coverage through the exchange who didn't have coverage before or who weren't eligible for Medicaid before is relatively small. So we've turned things upside down completely for 3 or 4 or 5 million individuals. Now, what's happened is that premiums didn't go down as the previous president promised. They've lost the coverage that they had. They've lost the ability to see the doctors or the provider that they wanted to see. So we need to move in a direction, again, that respects the principles of accessibility for all, affordability for all, quality and choices for patients, making certain that we, again, have that patient-centered system.
Well, let's go to the affordability aspect a little bit. First of all, can you say for certain that once this bill is passed, nobody will be worse off financially when it comes to paying for health care?
Well, I'll tell you right now, there are a lot of people that are worse off right now when they're paying for health care, and they aren't getting the care that they need. Again, the premiums are up and deductibles are up. If you're an individual out there making $50,000, $60,000 and your deductible is $8,000, $10,000, $12,000, you may have that insurance card, but you don't have coverage. And I hear from my former colleagues all the time about patients who come into their office and they recommend something for them and they're not able to get it because the deductible is so high. So what we want to do is to put in place a system that will allow for folks to select the coverage that they want, have it through a transparent and accountable system, competition that allows individuals to drive down the costs of the provision of health coverage. That's key to making certain that we've got a system that works for people, not government. Okay,
but I noticed you ducked the aspect of whether you can guarantee that nobody will be worse off financially.
I firmly believe that nobody will be worse off financially in the process that we're going through, understanding that they'll have choices that they can select the kind of coverage that they want for themselves and for their family, not that government forces them to buy. So there's cost that needs to come down, and we believe we're going to be able to do that through this system. There's coverage that's going to go up. Remember, Chuck, there are 20 million folks right now in this nation who said to the federal government, "Phooey. I'll pay a penalty or I'll take a waiver. I'm not even going to get coverage in the system that we currently have." That may be a system that works for government or insurance, but it doesn't work for people.
So you believe
we need a system that works for people.
You believe your system's going to add an additional 20 million over the 20 million that have had expanded coverage? You really believe that?
We believe I believe, and the president believes firmly that if you create a system that's accessible for everybody and you provide the financial feasibility for everybody to get coverage, that we have a great opportunity to increase coverage over where we are right now, as opposed to where the line is going right now, where people are losing coverage and we're going to have fewer individuals covered than we do currently.
All right, let me go to this financial feasibility issue here, because in Fayette County, West Virginia, this is one example. Kaiser Family Foundation estimates the following, that the $4,000 tax credit that a 60-year-old making $30,000 a year that will get under the American Health Care Act is almost $8,000 less than they would get under Obamacare. This is a county, by the way, that voted overwhelmingly for President Trump. The point is this, is you say this is going to make it more affordable and access to coverage under this plan in this county, in this state, less money and more expensive for these folks.
That's it. That's looking at it in a silo. If you look at it in the way that the market will allow then for individuals to have choices, who knows what that 60-year-old wants? I know that the federal government doesn't know what that 60-year-old wants. I know that he or she knows what he or she wants. And the way that you provide decreasing costs and choices for folks, you make it so that the system can actually be responsive to that individual. That's the way you drive down costs. So we believe firmly that individuals, and there are other portions of the bill that's currently being debated, that would allow for an opportunity for folks who don't have the wherewithal, don't have the financial feasibility to purchase coverage, to gain access to other resources that will allow them to have the coverage that they want.
Let me ask you this, though. Why not means test the tax credits? Why do it by age, where you may essentially have it where you're incentivizing folks not to buy health insurance until they actually need it?
Yeah, it's a great question. In fact, I've been working on this for so long. I've gone through the phase where I had it completely related to income, and then became convinced by the folks who actually do this on a day-to-day basis, day in and day out basis, that the most predictive element of an individual's life in terms of what health coverage will cost is not income, and it makes sense. It's age. As your age increases, your healthcare costs increase and the cost of the coverage increases. So they've pegged it to age. There's an opportunity to put some means testing in there, but that's not the most that's not the correlation factor to what it actually costs. Age is the thing that correlates best to what health coverage costs.
Okay, but age is also, I mean, this is a part of Obamacare that didn't work, which was to try to get as many young people on the system. They needed 40% of folks under 35 in the system to keep premiums down. It hasn't gotten to that high. But how do you do it? How does it do it here? Because, again, this system seems to essentially say to folks under 35, don't worry about it. If you don't want to get health care, we're not going to make you do it. And that only increases premiums for older folks, does it not?
No. What we do is actually say to that 30, 35-year-old individual, you know that you need health coverage. What we're going to do is provide a system that allows you an array of choices so that you can respond and choose the coverage plan that works best for you and your family, not be dictated to by the federal government and have to purchase something that you most likely do not need. That's how you get folks back in the system. You provide a product that is something that they want, not something that they don't want. And this is a great opportunity to look at the failures of the current system and say, how do we fix that in a way that puts patients at the center of all of this and not government?
All right, in 5 years, Dr. Price, define success. What is success? Give me the number of people covered and the cost of when it comes to percentage of income.
Yeah, it's tough to put numbers on it, but success, it's important to look at that, and it means more people covered than are covered right now, and at an average cost that is less. And I believe we can firmly do that with the plan that we've laid out there. Remember, it's not just this bill that's in Congress right now. It's a look at the regulatory apparatus that's been put in place over the past 8 years by the previous administration that has made it more difficult for folks to practice medicine, more difficult for folks to care for patients, driving up costs, and then it's an array of options from a legislative standpoint that actually reform the insurance coverage system so that you can purchase across state lines, you can pool together, again driving down costs, making it so that you've got an accessible, affordable, quality, and choices plan.
But a lot of those tweaks you can't do for a couple of years. So you're asking a lot of conservative members in the House and the Senate who are very uncomfortable with how much government control there is going to be even in this plan to essentially say, vote for it now. We promise we're going to deliver those other reforms later. Why should they trust you?
What they're hearing from their constituents is what the president heard during the last campaign, and that is that Obamacare has failed. The ACA has failed. And clearly what they want, what those members of Congress and the United States Senate want, is a system that works for patients. And so that's what we've laid out through both the legislative process and the regulatory process to have the Department of Health and Human Services. You know, there are hundreds of regulations that were put in place by the previous administration. We're going to look at every single one of them and answer the questions, does it help patients or harm patients? If it harms patients, it ought to go away. Does it increase costs or decrease costs? If it increases costs, it ought to go away. And we're going to go through that methodical process of, again, putting in place a patient-centered system.
We have two pieces of information we do not have yet, and yet there is already voting going on in Congress. One piece of information is the estimate of this bill, how many people would be covered, and the second is on what's the hit to the deficit. On the coverage issue, we don't know the financial issue yet. On the coverage issue, a couple of estimates out there. One as high as 15 million fewer people covered, according to one estimate from Brookings, that's what they believe the Congressional Budget Office is going to end up showing when they finally are able to come out with an estimate. 15 million, is that an acceptable number to you? If that's what it really is, do you go back and say, we got to tweak this?
Well, I'll tell you that the plan that we've laid out here will not leave that number of individuals uncovered. In fact, I believe, again, that we'll have more individuals covered, and I think we'll have folks that are evaluating this and modeling this come out and say, yes, indeed, this plan will, in fact, cover more individuals than are currently covered. Remembering right now, the trend line is down on the number of individuals being covered. It's not increasing. And the CBO estimate 5, 6, 7 years ago when this started, they estimated that over 20 million people would have coverage at the end of the 10-year window. In fact, it's about half of that right now. So CBO has been very adept in not providing appropriate coverage statistics. So again, we believe that more individuals will be able to be covered than in the current plan and will want to be covered because they'll be able to get something that works for them, not for government.
All right. This plan has some Medicaid expansion in it to a form, although you cap it in certain respects. This plan has tax credits. Another name for a subsidy. It's made some on the right say, you know what, this is Obamacare light. You're essentially accepting the architecture, but just trying to remodel the building. What say you?
No, absolutely not. In fact, this is a little puzzling because independents and conservatives for decades have said, shouldn't we equalize the tax treatment of the purchase of health coverage for folks who get it through their employer and folks who aren't able to get it through their employer? And that's exactly what the tax credits do. We don't dictate to people what they ought to buy or what they must buy. Mm-hmm. What we do is say, here's an opportunity for you to use a tax benefit that the 175 million individuals that are getting their coverage from their employer, those folks have a tax benefit. It's the moms and the pops out there. It's the person who's working at the corner grocery or the corner cleaners.
Should those folks have a tax benefit, or should people like you and me have to pay taxes on those health insurance benefits?
If part of our society has a tax benefit for the purchase of health coverage, then I'm of the belief, and the president is of the belief, that it needs to be fair for everybody. And that's the kind of system that we're looking for. And that's why you've got to have a tax credit.
So that's why you want a tax credit, but you're not going to get that revenue from upper income folks who get generous health insurance policies from their company?
Well, that's another system that's been in place. As I say, 175 million folks are getting their coverage through their employer right now, and that's a debate that we ought to have. But the fact of the matter is that the vast majority of the American people support making it equal for individuals who are getting it from their employer and not getting it from their employer. They're out there in the individual and small group market, which has literally been destroyed by the ACA, and that's what we're trying to reconstitute. That's what will reinvigorate the insurance market, but it'll also drive down costs because you'll have competition and transparency in the system.
Two quick questions here. One, there's a bill right now in Congress that would give employers access to genetic and medical information of their employees via some wellness program. It looks like it's something that could be used in unseemly ways, in a violation of employee privacy. Where are you on this bill?
Yeah, I'm not familiar with the bill, but it sounds like that there would be some significant concerns about it if the department's asked to evaluate it, or if it's coming through the department. We'll be glad to take a look at it.
And finally, there's been a fun little back and forth of whose bill is this? Is this the president's bill? Is this the House Republicans' bill? You, of course, you could argue you straddle both fences, a former House Republican in the Trump administration. Who owns this bill?
This is a piece of legislation that's coming through Congress. We've been working with everybody since I got into office in the administration. The president's been listening to folks ever since he started his campaign. The House and the Senate have been working together. It's been years in the making, and understanding and appreciating that the current law, the current legislation that's in place is not working for the American people who aren't in the employer-employee relationship. Those who are in the individual and small group market's not working for them, and so we've got to make certain that it does. And we want to provide choices for folks. Want to make it so that it's accessible. Health insurance is accessible.
You support this
affordable,
bill. You own
highest
this bill.
quality and choices.
You accept this bill. You own this bill. President Trump accepts this bill. He owns this bill. Fair?
we strongly support the plan, which is this bill, the regulatory opportunity to modify the system in a way that works for patients, and the other pieces of legislation that are required that can't go through on the first part.
Secretary Tom Price, it's going to be a long couple of months. We'll be watching, and I'm sure we'll be talking again soon. Thanks for coming on and sharing your views, sir.
Thanks, Chuck, so much. Take care now.
You too. Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and then click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.